Hello everyone, welcome to this week's lecture on prenatal development. Last week you watched The Miracle of Life, which thoroughly covers conception and fetal development through the prenatal period. We're going to review some of that information as well as some surrounding concepts. To start with, something you may or may not have thought about before is the history and progression behind motivations for parenting. Many factors may be taken into consideration when deciding to have children or not. One big piece is that more than ever, it is an individual choice. There isn't as much of a social expectation. For example, in the past, a societal expectation was to have children because that's what everybody did, or to have more than one so that they had siblings and weren't spoiled, or to have children early in life rather than later in life. We now have much more effective birth control methods, such as long-acting reversible contraceptives, also known as LARCs, which supports family planning, and there's much less social criticism for having children later in life. Over time, the motivation to have children has moved from one that emphasizes societal expectation to one that focuses on individual fulfillment. Although having children continues to be the norm, in 2013, about 30% of newborn babies were from unintended pregnancies, most of these being from low-income families with less educated mothers, and included circumstances such as delayed prenatal care and premature birth. Opportunities to explore childbearing motivations through school, health classes, and family planning may not decrease the number of unintended pregnancies, but could potentially lead to more informed, meaningful choices around having children. If you are a parent yourself, ask yourself, what are the benefits and disadvantages of parenthood? Benefits could be things such as giving and receiving love and affection, personal fulfillment, creating one's own family, nurturing a little one, being seen as a responsible member of the community perhaps, carrying on a family name, strengthening a bond with a partner. Disadvantages could be things such as constant worries for health and safety, a role overload, having to balance work and parenting, risks such as crime, war, pollution, finances, and loss of privacy. Let's jump right into prenatal development and review some of the associated terms. The first phase of prenatal development is the germinal period. This is the time of fertilization and formation of the zygote, which essentially is a fertilized female egg. Once the one-celled zygote is formed, the cells begin to duplicate and create a blastocyst, which is a hollow fluid-filled ball. The blastocyst then burrows through the uterine lining. During the germinal period, the placenta and umbilical cord begin to form. Phase 2 in prenatal development covers week 2 through 8 and is the embryo phase in which the foundation of the body structure is laid down. The heart, muscles, ribs, backbone, and digestive tract begin to develop. The nervous system is forming the neural tube, which swells to form the brain. Other organs are beginning to form as well, and the embryo responds to touch and can move. Phase 3 is the phase of the fetus and is the final phase lasting from 9 weeks through the end of pregnancy. As expected, there's a dramatic increase in body size, development of physical structures come to completion, and by the end of the second trimester, which is 24 weeks, most of the brain's neurons are in place and the fetus reacts to sound. The third trimester, which is also part of the fetus phase, covers weeks 25 through birth. During this time, the fetus reaches age of viability and has a good chance of survival if born. The brain is continuing to develop rapidly, enabling sensory and behavior capacities to expand. The fetus becomes able to distinguish different voices, language, and music sound. The lungs gradually mature, and the fetus increases in size and fills the uterus. Now that we have gone over the phases of prenatal development, let's talk about Prenatal environmental influences. Teratogens are environmental agents that cause damage during the prenatal period. The impact on development varies depending on the amount and length of exposure. Also, variables such as heredity and age of embryo or fetus can have influences on the impact. Some examples of teratogens are prescription and non-prescription drugs. People are more likely to take heed with prescription drugs. However, non-prescription drugs such as aspirin and Tylenol, even caffeine, can have effects on development. Other teratogens are illegal drugs, also tobacco, which can lead to low birth weight and increase the likelihood of things such as miscarriage, prematurity, cleft lip and palate, as well as asthma and cancer later in childhood. Alcohol is another teratogen which can result in developmental disorders such as fetal alcohol syndrome or partial fetal alcohol syndrome, as well as alcohol-related neurodevelopment disorders. Environmental pollutants and infectious disease are additional teratogens that can impact development during pregnancy. Chemicals in our environment can impair prenatal development and also increase the chances of diseases and health problems later in life. Diseases such as AIDS, chickenpox, and rubella, bacterial diseases such as chlamydia and tuberculosis, and parasitic diseases such as malaria and toxoplasmosis can all lead to miscarriage, physical malformations, intellectual disability, and low birth weight and prematurity. This graph, although not super clear on the slide, shows the sensitive periods in prenatal development. Each organ of the body has a sensitive period, which is a time where development may be impacted. The blue bars indicate highly sensitive periods, and the green bars indicate somewhat less sensitive periods. You can see in the first 5 weeks of pregnancy, the central nervous system, heart, upper limbs, lower limbs, ears, and eyes all enter into and have a sensitive period. From about week 6 to week 9, the ears, eyes, teeth, palate, and external genitals go through a sensitive period. As the embryo and fetus develops, the sensitive periods decline, but still many areas are in a less sensitive period, which means damage can still occur. In addition to avoiding teratogens and understanding sensitive periods, there are maternal factors that can support the healthy development of an embryo and fetus. Regular exercise, good nutrition, emotional well-being, plenty of rest, vaccinations, and prenatal care are all beneficial components of a healthy pregnancy. For example, moderate exercise in healthy women can lead to improved fetal cardiovascular functioning and higher birth weight. Exercise can also reduce the likelihood of other complications like gestational diabetes and high blood pressure. Good nutrition is also an important factor in supporting the health of the mother and baby, whereas prenatal malnutrition can have similar effects as teratogens such as miscarriage, low birth weight, and in extreme cases, physical defects. Prenatal care is another important component. The earlier the better in terms of outcomes. Although in the U.S. most pregnancies are free of complications, things can arise that need medical attention. Statistics show that mothers who enter into prenatal care later in their pregnancy are more likely to experience complications. A huge part of pregnancy is preparing for parenthood. While the fetus is developing, so can the relationship between parent and baby. Seeing the baby through ultrasound and feeling the baby move can help parents connect and make the idea of having a baby a reality. Building this bond while in utero helps support the beginning of a healthy attachment. Expectant parents can reflect on and discuss how they were parented. Identifying models of effective parenting is beneficial. Someone who has had healthy experiences with how they were parented can lead to higher self-esteem and can help to construct a positive image of themselves as parents. On the other hand, if the experience with their parent was negative, it can be difficult to establish a positive image of themselves as parents. Understanding what is available for support, such as counseling and community resources, is also helpful. Reflecting on one's past experiences with the way they were parented, acknowledging those experiences, as well as understanding one's own values and desired parenting styles, can help in leading to healthy relationships with their children and family. Lastly, the parental relationship is so important. Having a cohesive and supportive relationship during pregnancy can reduce anxiety and stress, factors that both affect prenatal development, and also set a solid foundation of partnership for when the baby arrives.